These activities are for many different types of stroke patients. It is very important not to feel any pain or shortness of breath while doing the activities. You may feel some stretching, and that is good. First, you need to gather a cup and sit at a table. Try to reach for the cup as you open your fingers with your elbow resting on the table. Try to maintain the fingers in an open position for a few seconds. If you are unable to open your fingers, take your other hand to assist. Then hold the cup on the table gently without crushing it. Try to raise the cup slightly off the table. Then bring the cup to your mouth and slowly bring your wrist and hand upward on an angle in order to take a sip of water. Afterwards, gently place the cup back on the table. Try to open your hand and remove your fingers from the cup. If needed, you can use your other hand to assist. Try to hold your fingers open for 5 seconds after the task. First, you need to gather a piece of food that you normally eat with your hands. This could be anything that is safe for you to eat and is about the size of a granola bar, cheese doodle, or small carrot. Now, sitting at a clean table with your arm on the table, have the item in front of you. Slowly place the food into your first 3 fingers. Gently try to pick the item up while bringing your wrist upward as much as you can. Then bring the item towards your mouth and take a bite. If it's too difficult for you to pick it up on your own, take your unaffected hand and place it into your affected hand. Still trying to bring your wrist up as much as possible and bringing your hand towards your mouth. Repeat as needed to eat the food. First, you need to gather a hand or dish towel and be seated at a table with your arms supported on the table. Next, place the towel in front of you. Take the corners of the towel that are closest to you in both hands, in between your thumb and index finger. Place the corners that are in your hand on top of the corners that are further away from you on the table. Next, rotate the towel so that the edges on the right or left are in front of you. Then grasp the edges of the towel again and fold it over, trying to use your affected side as much as possible. First, you need to be seated at a table with a phone placed in front of you. With your affected arm supported on the table, use your affected arm to reach for the phone receiver. Gently place your fingers around the handle and bring it towards your ear. Hold the phone with your affected hand and dial a phone number with your unaffected hand. Then replace the receiver back onto the base of the phone. If it's too difficult for your affected hand to grasp the phone, use your other hand to assist in grasping the phone and placing it into your other hand. Then bring your hand to your ear and dial the number again. Replace the receiver back onto the base of the phone. Now you can attempt to call someone on your own. First, you need to gather a bottle of your medication and be seated at a table. Then take your affected hand and try to grasp around the bottle with your arms supported on the table. With your unaffected hand, gently press down and twist to remove the cap. If it is not a child-proof cap, then just twist without pushing down. Once you have removed the cap, hold the medication bottle with your affected hand and turn your hand to empty one of the pills into your unaffected hand. If that is too difficult, hold your affected hand on the table and remove one of your medications with your unaffected hand. We want you to know that you're not in this alone. We are here to help you through it. Each small step is a step in the right direction.